Hello friends, welcome to Kavita Medicos Education. This is part third of inflammatory bowel disease condition. So here in part third, we are going to study with the medical and surgical management of IBD. So let's start with the medical management of inflammatory bowel disease condition. So here first medicine we have aminosalicylates. So these are the 5 aminosalicylic acid. They are anti-inflammatory drugs. They block the action of cytokines, they block the action of prostaglandins and leukotrienes, and prevent the inflammation into our inner lining of the gut area. So they are the mild form of drugs. They are given in the mild to moderate ulcerative colitis. So they are the drug of choice in ulcerative colitis, but these drugs can also be given to the Crohn's disease patient also. So they can be given in mild to moderate form of ulcerative colitis, and these drugs can be used for long-term medication. For example, we have mesalamine and sulfasalazine. Next drug we have corticosteroids. So corticosteroids are powerful anti-inflammatory drugs. They are given in moderate to severe form of ulcerative colitis and moderate to severe form of Crohn's disease condition. These are very powerful drugs. So they cannot be given for long term. Okay, so they cannot be given for long term because this medicine have lot of side effects. They are only given in the flare up disease condition when patient have a peak sign and symptoms, because these drugs will control the sign and symptoms in a very quick phase. Okay, so for maintenance of remission period, these drugs are not given. They are only given in the high flare up of disease condition. So they will give relief to the patient immediately. Okay, but they are very powerful anti-inflammatory drugs. For example, we have prednisone, budesonide, and hydrocortisone. Next drug we have immunomodulators or immunosuppressant drugs. So as the name is indicating, modulators, it means they are modifying our immunity. They are suppressing our immunity. Whenever our immune system get hyperactive or overactive, then our immune system attack our own gut area. So to prevent the hyperactivity or overactivity of our immune system, these drugs are given. Okay, so basically these drugs are given in the combination of corticosteroids and aminosalicylates. For example, we have azithromycin, 6-marcatabutene, and next we have methotrexate. Next drug we have biological therapy. These are the drugs which are the new form of drugs. Okay, they are the new form of drugs in the market, and these drugs are proteins from a living cell. Okay, so these drugs are basically formed from the living cell. They are the proteins. So these drugs will target the specific area of our immune system. They will not target the whole immune system. They will only target those molecules which are attacking to our immune area. So it will target only the specific area into our immune system, and they will work slowly, but they can be used for long-term medication. They will work in a slow process. So these drugs can be given for maintaining the remission phase in the patient. For example, in types of biological therapy, we have anti-TNF agent, for example, infliximab. Next, we have anti-integrin. Next, we have vidolizumab. And next, we have anti-interleukin 12 and 23, like ustekinumab. Next drug, we have antibiotics. So these are the broad spectrum antibiotics which are basically given to the Crohn's disease patient. Because in Crohn's disease, patient have a chances of infection due to the fistula formation, due to the abscess formation. So these drugs are basically given after the surgery and to prevent the infection from the bacteria. Okay, they are not given to every patient. They are only given for the surgery patient, and in which there are chances of infection or there are chances of complication of disease condition. Then these antibiotics are given. They are the sideline drugs. Example, we have metronidazole and ciprofloxacin. Next, we can give nutritional therapy. Nutritional therapy is very important in IBD disease patient because patients suffer from weight loss disease condition. He suffer from anemia condition. So in nutrition, we will give high protein, high calorie diet to the patient, and the meal should be in a small quantity and the meal should be in a frequent quantity. Again, other supplements like vitamin C tablets, vitamin D tablet, and calcium tablets, iron tablets, and folic acid tablets can be given to the patient. Nutrition can be given to the patient in two forms. First, we have enteral nutrition. Enteral means when the nutrition is given through the liquid form by the oropharyngeal route, okay, by the gastric tube. That is known as enteral nutrition in a liquid form nutrition. If patient is not able to take the enteral nutrition, then the nutrition is given through the veins route, that is known as percutaneous nutrition. When we will supply the nutrition directly into the bloodstream of the patient, that is known as percutaneous route of nutrition. Okay, so nutrition can be given in two forms. First we have enteral route, and next we have parenteral route, that is given directly into the bloodstream of the patient. If patient sign and symptoms are not relieved properly, or if the disease have a complication like toxic megacolon, or if there are chances of cancer, mostly in ulcerative colitis, then doctors will perform the surgery in patient. So what are the surgeries that are performed in the ulcerative colitis patient or in a Crohn's disease patient? First surgery, we have total proctocolectomy with endolestomy. Total means totally we are removing. What we are removing? Procto means our rectum area and colon area. So in this surgery, we remove the entire colon of the patient and the entire rectum of the patient. Matlab whole colon and rectum is removed here, and the end of small intestine, that is known as ileum. Okay, so ileum is brought out through the abdomen, and a small hole is made here, that is known as stoma. Okay, so ileum is brought out from the abdomen, and a small hole is created here, that is known as stoma, and the ileostomy bag is attached to that stoma, so that the patient stool can be passed into that bag. So it is a permanent type of surgery in the patient. So it's a permanent type of surgery because the whole rectum and colon have been removed here, and the permanent stoma is created in the right abdomen of the patient, and the permanent ileostomy bag is connected to that stoma. So it's very important to care for the stoma, for preventing the infection and complication of the stoma. So it's a permanent type of surgery. Basically, it is done in ulcerative colitis. Next, we have restorative. So restorative proctocolectomy with ileal pouch anal anastomosis. Restorative means here we are making a pouch. Okay, restorative means we are restoring something. We are restoring the terminal ileum here. We are making a restorative area, a pouch from the terminal ileum here. In this surgery, the entire colon as well as the rectum is removed, and a small pouch is made from the terminal ileum into the right abdomen area of the patient. So a small pouch is created from the ileum, and this pouch is attached to the anus. Okay, so we have taken the terminal ileum area and we have created a J-shaped pouch from terminal ileum, and that J-shaped pouch is attached to the anus area. Now this terminal ileum, which is formed in a pouch shaped, is a reservoir of a stool, is a storage area of the stool. In this surgery, patient can defecate or pass the stool in a normal way. But for 3 months, a temporary stoma is created in the right abdomen area until and unless that pouch is fully connected with the anus, or that pouch is fully get connected with the anus area. So a temporary stoma is created here, and after 3 months, this stoma is closed and patient can pass the stool in a normal way. So it's a restorative proctocolectomy with ileal pouch anal anastomosis surgery. So again, this surgery is performed in the ulcerative colitis patient. Next, we have subtotal colectomy with ileostomy. So it's an emergency kind of surgery. Subtotal means the half portion or the infected portion is removed here. So the half colon or the colon which is highly infected is removed here, and a ileostomy is created here. Again, a stoma is created here, and ileostomy bag is attached with that stoma, so that the fecal defecation or stool can pass in the ileostomy bag. So it's an emergency kind of surgery. Okay, so here we are not removing the entire colon, we are removing only the diseased portion of the colon, and the rectum is also not removed here. That is known as subtotal colectomy with ileostomy. Next surgery, we have resection with anastomosis. So basically, these 3 surgeries are performed in the Crohn's disease patient. Resection means we are cutting the area. Suppose this is our area of large intestine, and in the middle we have infected area. So this is the infected area of our large intestine. Resection means we are cutting the unhealthy portion of the gut area. We are cutting the unhealthy area. So here we are resecting or cutting the unhealthy or diseased portion of the intestine, and we are anastomosing the healthy ends. We are connecting the healthy ends. Now this disease portion have been removed and the healthy ends are again connected. This is known as resection with anastomosis. Next surgery we have structuroplasty. So basically in Crohn's disease condition, patient form a very narrow pathway in the small intestine area. So in this surgery we are not cutting the gut, okay, we are not decreasing the intestine area, we are only broadening the narrow portion. How it is how we are doing this surgery? So this is our narrowed portion of the intestine. So in this surgery a longitudinal incision is made, okay, a longitudinal incision is made in this way, and this incision is being sutured in a transverse way so that the length of colon is not get shortened. Okay, so a longitudinal incision is made and this incision is closed in a transverse way. That is known as structuroplasty surgery. We are widening the narrowed portion of the intestine. Next surgery we have abscess management. So a pus get collected in the Crohn's disease patient here. So abscess mainly formed in the Crohn's patient. So here we can remove the pus or we can remove the infected pus from the patient. How? By two procedure. First we have percutaneous management. In percutaneous management we are inserting the needle or we are inserting the catheter into the area and we are draining the pus from that area, okay, to prevent the infection or complication in the patient. And next we can also do the open surgery. If there are so many abscesses get formed, then we can do the surgery for the pus management. So whenever we are doing the abscess management, it's very important to give the antibiotics to the patient for preventing from the infection. So these were the management of inflammatory bowel disease condition. If this video are if my videos are very helpful for you, then please like, share and subscribe to my channel for more new videos. And at the last, thank you so much for watching my videos.